Hi, this is Dr. David Green, CEO of the Arizona Pain Network. Today's topic is an overview of degenerative disc disease. Now, first of all, I wanted to mention that it's not really a disease in a sense of like cancer or a failing kidney or COPD, but that's the moniker that it's been given. All right. So we know that a very large percentage, probably like 40% of people over the age of 40, have some evidence of degenerative disc disease. And what happens is normally, and I'm going to use the analogy of a jelly donut. All right, your disc, let's say, is a donut. Inside, it's pretty gelatinous and soft, and the outer part of the disc is much harder, and that's called the annulus. The annulus, or the outer part of the donut, has some nerve endings, and it can feel pain. If it degenerates and starts to get a tear in it, it can hurt. But the inner part of the disc, the jelly, doesn't have any nerve endings. It doesn't feel any pain whatsoever. Okay? So you have the outer part of the disc, that feels pain. The inner jelly, nothing. All right? So they've done studies looking at people over the age of 40 with MRIs, and a lot of people who didn't have back pain. And like I said, over 40% of those had degenerative disc disease. So just because you see it on an MRI doesn't mean you're going to have a life of pain. Okay? So what's happening when you have degenerative disc disease is almost like a tire that's getting flat. I'm going to use another analogy. Now, normally the tire is inflated, it's happy, it's healthy. It helps absorb the shock of when a car goes over speed bumps. And it's similar to your body. When your body runs or jumps, the disc absorbs shock. And the way it does that, it's composed of 85% water. So as you run and jump, the disc compresses, water shoots out, and then water comes back in. Now, when you start to get degenerative disc disease, you start to lose that water content. So the tire starts to lose some air, so it starts to bulge out. You ever seen a tire that's getting flat, it starts to bulge out? That's what happens with your disc. And when that happens, you get a bulging disc. I'm sure you've heard that term. And you can see that on an MRI. The disc starts to lose water, and on an MRI it starts to look black. Some people call it black disc disease. And then you start to see a rounded area where the disc is bulging. And that's degenerative disc disease. That's how it rolls along. Eventually, if it gets worse and worse and worse, you lose more and more water content, and the disc starts to get flatter and flatter, and it can almost become a pancake. Okay? So what happens with degenerative disc disease that's symptomatic? Well, symptoms may include pain in the low back. It may be pain that radiates out to the right and left side, or one versus the other, because degenerative disc doesn't always occur symmetrically. It might be that one side's worse than the other. All right. Now, you can also get inflammation around the disc. It can irritate chemically a nerve root that's nearby, and it can cause pain to shoot down into your buttock or thigh area. All right. So that can be occurring as well. And that pain can potentially bother you every day. It might bother you once a week, once a month. It might go like this, wax and wane. So it's not, everybody doesn't present the same. And that's, part of the issue is it becomes an elective situation. So we've done other videos on the treatment options for degenerative disc disease, but suffice it to say that over 90% of individuals who have symptomatic degenerative disc disease can get to a stable level of baseline pain where they don't need surgery, they can function, they can work, they can concentrate, play with their kids, participate in recreational activities. So I'm going to very quickly run through the treatment options because I go into depth in other videos. One, medication management. Chronic opiates are not recommended. Usually it's anti-inflammatories and Tylenol. All right. The opiates are reserved for exacerbations. Two would be physical therapy, chiropractic treatment, spinal decompression therapy. Okay. So things that are done therapeutically. And then you have a bunch of interventional type procedures. You can have regenerative medicine procedures like PRP therapy and stem cell injections. You can have steroid injections either into the disc or around the disc. Radiofrequency ablation is a procedure that may be beneficial for you, and acupuncture can be very helpful. So just look at the other video on treatment options for degenerative disc disease. But that's the overview. When you look overall at the reasons for low back pain, 40% is from degenerative disc disease. Another 40% is from arthritis, and the other 20% is typically from the sacroiliac joint causing low back pain. Visit us online today at ArizonaPainNetwork.com. There's a lot of educational information on there. You can see the treatment locations, the treating doctors, the insurances that we take, and the phone number to call to get scheduled. Thank you very much for watching.